All right, so today we are talking about sudden illnesses. So this week, by Friday, we have two tests that need to be taken. One is the Before You Care, which is a formative grade. The second is the CPR and AED adult, child, and infant. And then next week, once we get done with this material over some basic first aid stuff, that will be our final test. So we'll go ahead and get started today. Some of the stuff we have reviewed before, so we'll just kind of briefly cover it. So shock is going to be any serious illness or injury can lead to shock, which is a life-threatening condition. And again, we talked about it to some extent. Shock is going to be when blood starts to pool in areas of the body for whatever reason, and the body is unable to get oxygenated blood to our tissues and our organs, which can cause some of these signs and symptoms. So I'll let you read those signs and symptoms of shock there. If we suspect shock, we do need to call 911. We'll then have that person lie down if at all possible. We want to control bleeding if that is necessary. We can cover the person with a blanket to prevent loss of body heat. We don't want to give them anything to eat or drink, as they could potentially choke on it, and just reassure them while you're waiting on EMS. So heart attack, we've also talked about at length. Again, heart attack is a blood flow issue, which can cause damage to the heart muscle. And if we suspect signs and symptoms of a heart attack, again, we need to seek advanced medical care as soon as possible. We've watched the video on that. So signs and symptoms of a heart attack, again, we've talked about these at length. You can read those, some of the more common signs and symptoms there as well. So people, again, important to note that people may experience signs and symptoms of a heart attack differently. Not everyone's going to have the same signs and symptoms. And even people who have had multiple heart attacks may experience different signs and symptoms with their second or third heart attack. There also are some gender differences with heart attacks. So males often have more of the classic signs and symptoms, such as chest pain radiating down the left arm. And women's heart attack signs and symptoms are typically less severe and more general. So like anything else, if we suspect someone might be having a heart attack, we call 911. We're prepared to give CPR or use the AED if they become unresponsive, and just try to help that person rest in a comfortable position. We can offer to get any prescribed medication they may take for chest pain and assist them with taking it if necessary, and just continue to monitor their condition until EMS arrive. Okay, so breathing emergencies, some of the signs and symptoms, obviously, if they're not breathing at all, this is an emergency. If they're having shortness of breath or trouble breathing, if they are unable to talk without stopping for a breath in between every few words, also looking at changes in breathing rate, depth, or rhythm. These may be signs or symptoms of a breathing emergency. So also looking for gasping, wheezing, gurgling, or high-pitched noises. Any changes in skin color, temperature, or condition may be signs of a breathing emergency. Dizziness or lightheadedness, chest pain, and apprehension or anxiety. So if a person is having trouble breathing, we need to first determine whether or not we need to call 911. We want to help that person rest in a comfortable position. Oftentimes sitting and leaning forward slightly will help make breathing easier. And if they're having difficulty talking, we want to try to phrase questions that can be answered by them either nodding or shaking their head. We want to offer the person help with his or her medication if appropriate, so asthma inhaler or epinephrine auto-injector. We want to continue to watch for changes in the person's conditions, and we need to be prepared to give CPR and use the AED if they do become unresponsive.
People with asthma may have difficulty breathing when they are exposed to certain substances or conditions called triggers. Common triggers include exercise, temperature extremes, air pollution, strong odors, allergies, respiratory infections, and stress. Exposure to the trigger causes the airways to swell and become narrower, making it harder for air to move in and out of the lungs. Signs and symptoms of an asthma attack are similar to those of any other breathing emergency and include wheezing or coughing, rapid shallow breathing or trouble breathing, being unable to talk without stopping for a breath in between every few words, anxiety and fear, sweating. A person with asthma can minimize the frequency of asthma attacks by avoiding triggers and taking prescribed long-term control medications. But when an attack occurs, prompt action is needed to open the airways and restore normal breathing. The person will most likely have a prescribed quick relief or rescue medication to use in the event of an asthma attack. Encourage the person to use his or her quick relief medication as directed by his or her healthcare provider, assisting if needed and state or local regulations allow. Call 911 or the designated emergency number if the person's breathing does not improve within 5 to 15 minutes after taking the medication, or if the person becomes unresponsive. Monitor the person's condition until the person is able to breathe normally or until help arrives.
Okay, so a person with asthma, they may have a quick relief or rescue medication to stop the asthma attack. These medications work quickly to relieve swelling, opening the airways right away, and they are often administered through an inhaler. So if a person requests your help using an inhaler, you can shake the inhaler, remove the mouthpiece cover, and attach a spacer if used. We want to give the inhaler to the person and advise the person to use it as directed by his or her healthcare provider. So if that person's breathing is not improving within 5 to 15 minutes, we want to go ahead and call 911. And if that person becomes unresponsive, we need to go ahead and make sure that 911 is called and begin CPR and use the AED as soon as possible. Moving on to anaphylaxis.
Anaphylaxis is a severe allergic reaction that can develop within seconds or minutes of being exposed to an allergy trigger or allergen. A person who is experiencing anaphylaxis may have trouble breathing and go into shock. Because anaphylaxis is life-threatening, it is critical to act quickly to stop or slow its effects. To recognize anaphylaxis, look at the situation and the person's signs and symptoms. If you know that the person has been exposed to an allergen, look for trouble breathing or signs and symptoms of shock. Remember that signs and symptoms of shock may include excessive thirst, pale, cool, moist skin, changes in level of consciousness, and a rapid, weak heartbeat. Unknown exposure plus trouble breathing or signs and symptoms of shock equals anaphylaxis. If you think the person may have been exposed to an allergen, look for any two of the following signs and symptoms. Any skin reaction, such as hives, itchiness, or swelling. Swelling of the face, neck, tongue, or lips. Trouble breathing. Signs and symptoms of shock. Nausea, vomiting, cramping, or diarrhea. Any two of these signs and symptoms, in combination with suspected exposure to an allergen, equals anaphylaxis. If you do not know whether the person has been exposed to an allergen, look for any skin reaction or swelling of the face, neck, tongue, or lips. If the person has a skin reaction or swelling, and the person is having trouble breathing or showing signs and symptoms of shock, then assume anaphylaxis. When you recognize that a person is experiencing anaphylaxis, have someone call 911 or the designated emergency number immediately. If the person has a prescribed epinephrine autoinjector or an autoinjector is available and you are authorized to use it, help the person use the autoinjector. When administering an epinephrine autoinjector, be sure to hold the leg firmly during the injection to limit movement of the person's leg. Remember that anaphylaxis is a care-first situation. So if you are alone, help the person first and then call 911 or the designated emergency number. While you wait for help to arrive, make sure the person is sitting in a comfortable position, or have the person lie down if he or she is showing signs of shock. Provide reassurance. If the person is still having signs and symptoms 5 to 10 minutes after the first dose and emergency responders have not arrived, help the person administer a second dose if another autoinjector is available.
So with anaphylaxis, epinephrine is going to be the drug that is used to slow or stop the effects of anaphylaxis. That is where epi and EpiPen comes from. So epinephrine is what we use. If a person is showing signs or symptoms of anaphylaxis, number one, we need to have someone call 911. We can help the person use medication for the emergency treatment of anaphylaxis. Again, most people with EpiPens are familiar with using them, as they have probably used them a few times in their life. We also want to make sure the person is sitting in a comfortable position. We may have that person lie down if they are showing signs of shock. And if we are alone, we can help the person with the medication and then call. This is one of the few scenarios. Instead of check, call, care, the appropriate steps are going to be check, care, and then call. Moving on to diabetic emergencies, we can see some of the signs and symptoms here of a diabetic episode: dizziness, shakiness, headache, cool, moist skin. Big ones are going to be changes in behavior, whether they're more irritable or aggressive or argumentative. They may also be confused or disoriented, and potentially in severe cases may have a loss of consciousness, seizures, or both. So if a person is responsive and able to safely swallow, we want to give them about 15 to 20 grams of sugar. So you can check labels of packaged products to determine how much of the package's contents we need to give. So a couple reasons why we may call 911 in a diabetic emergency. Obviously, if they become unresponsive, if they're unable to swallow, if they don't feel better in about 10 to 15 minutes after taking the sugar, or we cannot immediately find a source of sugar. Okay, so moving on to seizures. To care for a person that is having a seizure, number one, we just need to let the seizure run its course. We want to remove any nearby furniture or other objects that could cause injury if the person hits them during the seizure. So kind of making sure that they're safe. Let the seizure run its course. We also need to kind of time the seizure as well, so we know how long it lasts. So if the seizure is over, we want to check the person for responsiveness. If they are responsive, we want to check that person from head to toe, place that person in the recovery position, and go ahead and stay with that person until he or she is fully recovered and aware of his or her surroundings. So some reasons we may need to call 911 with seizures: if it lasts more than 5 minutes, or if the person has multiple, if they were injured as a result of the seizure, if they are unresponsive after the seizure, or if the person is pregnant or has diabetes. We also want to call 911 if the person is a young child or infant and the seizure was brought on by a fever, if the person is elderly, if it's their first known seizure, or we don't know the cause of the seizure, or if the seizure took place in water. So these are all reasons we may need to call 911. And we will stop there for the day. Reminder, you do have 2 tests that will be due at the end of the week. We will continue on with this material, and we'll have a first aid test due early next week as well.